Honorable delegates, distinguished colleagues, on behalf of Armenian delegation, I would like to warmly greet the organizers and participants of the General Assembly high-level meeting on HIV and AIDS. The COVID-19 pandemic has more than ever highlighted the need for comprehensive measures to strengthen the health system and improve preparedness to fight epidemics. In the process of responding to the pandemic, the health system of Armenia utilized the capabilities and pathways created within the framework of national programs to combat HIV and AIDS, and were very important assets in the fight against COVID-19. However, at the same time, difficulties arose in the meeting of the UN goals on fighting HIV, AIDS, and achieving the 2030 Agenda for Sustainable Development all over the world. Armenia was not an exception. The political declaration on HIV and AIDS highlights the key approaches, the steps needed to prevent AIDS as a public health threat and accelerate the progress towards achievement of the Sustainable Development Goals. Few countries were able to even partially achieve the goals defined in the previous declaration, which is why it is utmost important that the new declaration considers the priorities and the strategic goals of the member states. We are pleased to note that the number of messages highlighted in the political declaration coincide with Armenia's main concerns and priorities, including elimination of stigma, discrimination, and restrictive laws, policies, and practices, and creating favorable social and legal conditions. Keeping vulnerable groups in the spotlight and ensuring maximum service availability. Ensuring access of women and girls to the quality health care. Introduction of universal health coverage. Ensuring multi-stakeholder partnership. Interstate cooperation to create regional mechanisms to combat HIV/AIDS. Dear colleagues, COVID-19 pandemic has overwhelmed health systems, disrupted essential health services, deepened inequalities, and posed serious threats to the education of an entire generation of young people. However, it also displayed the flexibility of the HIV response and the benefits of HIV instruments in health and development sectors. Through the implementation of care and treatment support activities and the distribution of medicines by non-governmental organizations, the community service delivery system, pioneered in the HIV field, was widely applied in the COVID-19 response activities and helped to overcome the barriers caused by the pandemic. It is also important to mention that HIV/AIDS high on the agenda of the international community and ensure its sustainable funding despite the heavy financial costs caused by COVID-19. The global health crisis has made us realize that we cannot continue to invest insufficiently in pandemic preparedness. Outcomes of the HIV programs have demonstrated that too little investment, which are made too late, increase risk and uncertainties, create conditions where millions of people need essential health services, hence further increasing healthcare costs. Ladies and gentlemen, if there is one lesson to learn from COVID-19 pandemic, as long as we fail to reinvigorate our efforts in eradicating the known infectious diseases, we will not be able to fully prepare ourselves for the new ones that are bound to come. Thank you.